Assalamu alaikum students, my name is Prafyaz. I'm from batch 5 and today my topic of presentation is the latest technology used in heart surgery. First of all, we'll discuss the abstract of my assignment. In my assignment, I'm going to explain the different types of cardiac surgery, their procedures and advancements in their equipments and different kind of machines used in these kind of heart surgeries. First, I'll explain the intro. Heart surgeries can perform whenever we will get the heart problem or whenever our heart will not function properly. In some cases, heart surgery may be a medical emergency. For example, whenever you get heart attack, that's the emergency kind of situation, and you need to done your surgery in order for your hearts to get function properly. So there are different kind of heart surgery which we can perform. For example, minimally invasive cardiac surgery, robotics assisted cardiac surgery, transcatheter aortic valve replacement, hybrid cardiac procedures, deadlift pacemakers, implantable cardioverter, defibrillator. So there are different kind of risk we can get while we are getting our heart surgery done. You can get bleed. There are different kind of infections you can get on the surgical part, and you can get the arrhythmia problem. Arrhythmia is the problem in which you get the improper breath, and your kidney, liver and lungs can also be damaged due to the heart surgery. First of all, I'm going to explain my first type of cardiac surgery. Leadless pacemaker is basically a small device, and it is powered by a battery. This battery usually send the electrical signal to your heart, and in this way your heartbeat gets normal. Unlike traditional pacemakers, which are usually placed inside your heart by getting the surgery done. Leadless pacemaker get inside in your body with the help of the catheter, and there is no need for the chest incision. And after that, usually a proper medication is advised to the patient. 90% this surgery is very successful in the whole world, and the leadless pacemaker usually implanted in the right ventricle, and in the simple vein to just perform your surgery done, and there is no need of chest incision. So next we are gonna jump on the advantages of leadless pacemaker. Leadless pacemaker usually have many advantages over the traditional pacemaker because it eliminates the complications like infections, and there is no hematoma formation. Hematoma formation is basically is basically formed whenever different types of tissues and cells get accumulated in a place, and usually fractures are also not associated with it. And the battery life of the leadless pacemaker is usually 5 to 15 years, which means that the patient can survive having a leadless pacemaker inside his heart for this time of duration, which is very helpful to the patient. Next, we're gonna jump on the disadvantages of leadless pacemakers. It usually have a risk. For example, we can only implant it only in single chamber ventricular pacing. For example, there is atrial pacing. We cannot place this leadless pacemaker into that part of our heart. So this is the cons of leadless pacemaker, and it does not have the defibrillation capacity. What is the defibrillation capacity? Defibrillation capacity is the capacity is or the rhythm in through which the pacemaker provides the signals to the heart. So it is inappropriate for that, and also when the patients need the dual chamber pacing, they cannot get implanted the latest pacemaker in their heart, and so that's the disadvantages of a leadless pacemaker. Next, we'll see the used machine and its working. Machines usually a catheter is used to implant the pacemaker inside the heart, and it is a small kind of chip which get attached to your heart and provides a normal rhythm to your heart. And it usually your healthcare provides customized leadless pacemaker, and it usually sends small electrical impulses to your heart as it is needed. It senses your heart's natural electrical signals and provide additional impulses when necessary. Whenever our heart doesn't get the proper impulses, this pacemaker provide the impulses to our heart. Next, we're gonna jump on the latest research, which is getting performed in the leadless pacemaker industries. So, leadless devices technology offer shows a promising advancement for possibly expanding the pacing capabilities, and the duration of the leadless pacemaker is also getting increased day by day. And postoperatively, following a transcatheter aortic valve displacement, usually 28% successful in the whole world. And the current leadless pacemaker are designed to be compatible with magnetic resonance imaging. For example, our leadless pacemaker can work in getting accordance with the MRI. So that's the advantages. Next type of heart surgery which is getting done in these days is implantable cardioverter defibrillator, and is usually abbreviated as ICDs. And implantable cardioverter defibrillator is basically a small battery which is powered inside your chest, and it detects the heartbeats, and it also stops the irregular heartbeats, which is the condition which we call arrhythmias. And it usually continuously monitored the heartbeat, and it also delivered the electric shocks to the heart whenever it is needed to get the irregular rhythm. So next we'll see that why do I need an ICD. So there are certain conditions in which we need an ICD. For example, candidates also included those with the life-threatening arrhythmias. For example, whenever the patient get the irregular heartbeat, then it need to have the implantable cardioverter defibrillator inside its heart for getting their heart to function properly. And whenever they get acute myocardial infarction. What is myocardial infarction? Myocardial infarction is a disease in which you get a heart attack. And for example, whenever your blood flow will also get reduced in your muscles, then you also need to have the ICD. There is a proper operating mechanism according to which the ICDs work. For example, it is usually a battery. It is powered by pulse generator, and it is the size of pocket watch. So it has basically a very small size, which is very handy to the patients, and they can get recovered by getting implanted with these kind of devices. And it is usually implanted below your collarbone or along your rib. So in infants are usually the children before they were born. So in infants, if this arrhythmia is a normal condition, then it may also be placed in abdomen in case of infants. But in gentlemen and in young people, it is usually implanted under the skins, below the collarbone or along the ribs. So operating mechanisms of this device is that it usually had a small kind of generator and has wires or LEDs, and is usually run onto the hard surface or inside. There is a proper mechanism of setting this ICD machine inside your heart, and it is installed through the blood vessels, and there is no need for open chest surgery in that case. And what's the function? It usually detects abnormal heartbeats, and return your heartbeat to a normal rhythm whenever it just operate its mechanism. And if equipped with the pacemaker feature, it acts as a pacemaker. Usually it act as pacemaker by sending tiny electrical signals when the heartbeat get too much slow, or whenever our get too much fast, then it also send the tiny electrical signals to our heart for to function properly. For fast or chaotic heartbeats, it usually delivers the defibrillation capacity to restore a regular rhythm. For example, whenever our heartbeats get too much fast, then it provides us a shock. In that case, our heart get a normal rhythm, and it usually works 24 hours. So in this, you can see the diagram. There's a small device which is usually highlighted as pulse generator, and this pulse generator is implanted below your collarbone, and it is providing normal impulses to your heart. And next, there is the internal chemistry of ICD device in this diagram. we can see that ICD device usually consists of lead wire and pulsator, which usually provides rhythm to the heart, and there is a capacitor inside that battery which usually charge that battery. Next, we're gonna see the advantages of ICD. ICD is usually designed to treat dangerously fast heart rates, and it also continuously monitor your heart, and it provide shock to your heart whenever it get too much fast rhythms, and it really work 24/7. So it is a very easy and useful procedure for the heart patients. And it also has some advantages. For example, you can get infection at the site where your surgeries get done, because surgeries usually get done to implant this device below your collarbone. So in that case, the patient could have the infection at that site. Next disadvantage is that it could cause the failure. So whenever the therapy get failed, then there is a just no need of surgery. So we need to have the extra therapy. Also, we also need to have the extra therapy whenever we have the ICD inside our heart, because it is just not that necessary. Next, we'll see the latest research which is getting performed in the ICDs area. In the future, there is a potential integration that the ICD could work with the ventricular paces as well as with the articular paces. So at the same time, it could provide the rhythm to both chambers of your heart. And there are also advancement in ICDs that that you can control your device, which is just placed inside your heart with the help of the remote, so which is outside your body. So that's the latest research which is usually done in this kind of surgery. So third type of heart surgery is minimal invasive cardiac surgery. In minimal invasive cardiac surgery, or there is the involvement of small cuts in the chest, and between the ribs, without cutting the breastbone, like in traditional open heart surgery. In this, we cannot cut the breastbone to implant our device into the heart. So this approach is usually used to treat various kind of heart conditions, such as closing the heart holes, fixing defects in your heart, and repairing or replacing heart valves. So next, we will see that why it is done. Usually this surgery is done because there is a hole in your heart, and if there is a tumor in your heart. And next, we'll see that how the minimal invasive cardiac surgery is done. Your surgeon will give you instruction to prepare for minimal invasive heart surgery. And so before getting your surgery done, you need to stop your medication, and then the procedure is started. During minimal invasive cardiac surgery, a cardiac surgeon will operate with the following list mechanism. For example, it will make one or more small cuts on the sides of your chest, and then it will insert a small surgical tool or a robotic arm through the incision, so that the exposed area get open to the surgeon. So then the surgeon will guide the tools between your ribs to reach your heart. In this case, your heart will be repaired, and if there is a valve in your heart, then this valve will also get replaced by putting devices. Or then whenever the whole surgery is done, then the incision will be closed with the help of the stitches on your heart. There are different advantages of minimal invasive cardiac surgery. For example, there is a less blood loss, low risk of infection, less pain, less time needing a breathing tube, also called ventilator, and less time spent in the hospital, and it has a faster recovery. And there are smaller scars which are usually getting done in the invasive cardiac surgery. But there are also disadvantages of this kind of surgery. For example, you'll get bleeding, you'll get an infection at the specific site where your surgery will get done. and you'll get the irregular heart rhythm or arrhythmia. You can also have a stroke. Stroke is a condition in which your brain impulses just burst, and you can also eventually have that. Different kind of latest researches are also getting performed in this minimally invasive cardiac search area. For example, physicians and different kind of scientists are also getting involved at that in the videoscopic and robotic assistant. So robots are helping in cardiac surgery. So fourth type of heart surgery is robotic assistant cardiac surgery. Robotic assistant cardiac surgery is the same as that of minimal invasive cardiac surgery, and same kind of techniques are also used in that case, but there is a major difference in it, that in invasible cardiac surgery, usually surgeons usually perform this surgery, but in robotic assistant cardiac surgery, robots usually perform this whole operation on the patient. The Vinci surgical system is one of the best example of the robotic system used worldwide. And next we'll see that what is the procedure of performing the robotic assistant cardiac surgery. First of all, patients need to prepare for getting the surgery performed. They usually get anesthesia, or the small incisions are usually made with the help of the robotic instruments. Next, there is this special setup of a robotic system which usually operate on that cuts and wounds of the patients. Next, there are console operation. A console operation is basically operation in which we get the 3D images of the patient's whole chest. After that, there is a surgical execution in that the robot surgeon usually guide the robot's arms to perform the necessary surgical tasks, such as the cutting and culturing tissues. Next, there is a real-time monitoring. There is a real coordination between the surgeon, which is usually operating the robots, and the robots operating the patients. Then there is the completion and closure. Whenever the whole surgery gets done, then the surgeon give instructions to the robot to just stitch those open and cut parts. After that, then this whole surgery gets done. There are potential advantages and disadvantages using robot as a surgery. So for example, in advantages we can see that there is a high chance of getting a precision surgery done, because the man could also make mistakes in this kind of surgery, but robots are very caution with their precise movements, and there is less chance of human error in this kind of surgery. And there's also advantage of minimally invasive. In this kind, we robots usually made the small incision, so the cuts and wounds are not that open in that case. uh, and it has the enhanced visualization, because the robotic setup also has the 3D visualization. So in this case, we have the proper access to the whole patient's inner examinations. Then there is a reduced blood loss in that case. If there is a small cut are being performed on the patient's chest, then there is not high chances of blood loss of the patients. Then shorter hospital stays, patients could leave after the surgery gets done, and then it has the quicker recovery and also has the less pain. There is also some certain kind of risks using robots as performing the heart surgeries. For example, the cost gets too much high whenever we use a proper robotic setup to operate on a patient. Then it also had the learning curve and technical issues and different kind of infections and access issues. So latest researches are also being performed in the robotic setup, and also improving the whole setup to provide a handy system. For example, it usually hybrid procedures are getting introduced into it. Also, the enhanced imaging also being used to make it better and better every day. And then training and education to the surgeons are also being provided, which are usually controlling the whole robotic setup. And then there is also outcome studies in which we study that which kind of operation is being done, and how many chances are of it to get a completion. Then the robotic system also has the advancement, and it is handling a different kind of cardiac procedures. Then we will see the chemistry involved in manufacturing a robotic machines. For example, if we are using robots to operate the patients, we need to have a proper robotic setup in order for the patients to get surgicated. For example, the materials are usually selected which have the high lifetime, and they are made up of polymers and ceramics, and also the metals which are usually made up of stainless steel and titanium. And the coatings of these machines are also made up of very high material. For example, polytetra fluoroethylene, which is usually specified as PTFE. And coating of the machine is performed with this material, and there are also lubricants in the machines which are being used. And there are adhesives and sealants are also being used, which have the high quality. And the electrochemical aspects are also being studied in the latest research of robotic setups. And there is a sterilization chemistry, which usually have the common methods. For example, ethylene oxide sterilization, hydrogen peroxide gas plasma sterilization, and autoclaving. There's a test of biocompatibility whenever we just set a robotic setup. For example, we need to just assume that whatever the instruments or equipments we are using for the surgery are either not harmful for the patients. So if they are harmful for the patient, we need to just have another setups and another materials kind of machine. There is a fifth type of heart surgery, which is the transcatheter aortic valve replacement. There is the replacement of the aortic valve of the heart through the blood vessel got done. And there are different types of this kind of heart surgery. For example, transcatheter aortic valve replacement, which is usually abbreviated as TAVR, and it is also known as TAVR as transcatheter aortic valve implantation. So it is also abbreviated as TAVI. Usually, a specific method is usually followed to perform this kind of procedure. First, we need to have the preparation for TAVR. Next, we have the access points, and then there is the valve placements, and then there is a deployment and also the functional assessments. After that, the whole catheter is removed, and then CN is just closed after requiring minor stitches. There are really benefits of getting this type of surgery done. For example, it usually have the minimal invasive, because TAVR is less invasive than traditional open heart surgery, because usually we make less surgeon will make less cuts and open wound. Next, it is suitable for high risk patients. For example, if the patient have the risk of getting heart attack sooner or later, then this kind of TAVR is done for the patients. It has in Whenever a patient get TAVR, it also has the quicker chance of getting recovery. And but also there are risks of getting this kind of surgery done, because it would cause the vascular complications. There is a risk of damage to the blood vessels during the catheter insertion, which usually implanted inside your heart. And in this case, the bleeding of the patients would get very high, and there are chances of getting stroke. For example, it will make a stroke, and valve will get leak. In that case also, there are high chances that a patient could get infection at the site of the catheter insertion or within the heart. So it also has this kind of risks. So sixth type of cardiac surgery is a hybrid cardiac procedure. Cardiac procedure provides a combination of surgical and intervention techniques to treat cardiovascular condition. Intervention technique include the catheter. For example, you need to implant the catheter inside the patient's body in order for their heart to function properly. It allows a tailored approach. For example, it utilizes the best method and best approaches to treat the patients. And there are different types of hybrid cardiac procedures. A hybrid cardiac procedure can be either a one stage or two stage procedure. There is a specific kind of differences between the one stage and two stage procedure, and but especially there is a extent of time lapse between the two components of the hybrid surgery. For example, a one stage procedure is done in hybrid suite and requires a specialized operating room, like the whole area would be for the hybrid cardiac procedures. But in the two stage procedure there is a time gap between the catheter intervention and the surgical operation. For example, whenever you'll get your catheter placed inside your heart, and after a specific time the surgical operations would be performed on the patients, in order for the surgery to get done. Then the hybrid procedures, it usually combined with the surgical intervention approach, also have the risks and benefits. First we'll discuss the benefits of this kind of surgery. Benefits usually include the minimal invasiveness, because there are usually small kind of cuts and bounds which are usually made in this kind of surgery. So it made possible the shorter hospital stays for the patients. And then there is a precision and customization, and combining surgical and interventional methods also allows for a more tailored approach for each patient's cardiovascular condition, and it optimizes your outcomes. Then there are specific risks for this kind of heart surgery. For example, there are complications from both approaches. You can also get complication in your one time stage and also for the second time. So there are chances for the infections, bleeding, and vascular injuries. Then they're also skill dependent. But for example, if the surgeons and the person who is just controlling the whole surgical operation is not trained or specialized or well skilled, then this kind of surgery can get complications. And next, hybrid cardiac procedures also involve a combination of traditional open heart surgeries and minimal invasive techniques. And machines are commonly used in this kind of procedures, and usually the name of these machines are cardiopulmonary bypass machines, which are usually abbreviated as CPB. And then fluoroscopy machine, which usually operate on the X-ray images. Then there's electrocardiogram machines, and this machine usually monitors the heart's electrical activities throughout the procedure. Next, there is a seven type of operation which is usually used in the cardiac surgery, and it is the 3D printing in cardiac surgery. 3D printing technology has been rapidly applied in this kind of medical situation, especially in these recent years, because the 3D printing can provide improved visualization and anatomical structures of the patients, and it also guides the patients properly that from which side they should get the operation done. And with increasing aging and complexity of cardiac condition, there is a current surgical or transcatheter procedures which usually required advanced precordial images and individualized treatment, and that is the 3D printing. 3D printing may be prepared for a well tolerated treatment, and it also provide a substantial information, and it is usually led for the very precision or accuracy for the cardiac surgery. And although the use of 3D printing in cardiovascular surgery is still a relatively newer development, then but the applications for adult cardiac and vascular surgery or catheter based intervention are also emerging, and contemporary reviews and reports are warranted. Then there is a latest kind of researches which was also getting done in 3D printing system. For example, one innovation is that in the printing method there is a increased printing speed by 10x. So this means that the surgeon could have the images of the inside anatomical structure of the patients with the 10x speed than that of the previous one. So another group of engineers is also using the lights to carve the intricate designs into satisfactory mounts of designs, and that would hoping to eliminate the need to build from the bottom up. Then next, I'm concluding my assignment. In my assignment, the cardiac surgery, I would like to say that cardiac surgery play a crucial role in treating various heart conditions, and its success usually relies on the advancement in technology and specialized equipment. and different kind of machines are being used, and latest kind of research is getting done day by day in different areas of the cardiac surgery. But as the technology continues to advance, the uh, future holds promises for even more innovative approaches in cardiac surgery are also getting done, and this is just enhancing the overall effectiveness and safety of this life-saving procedures. Thank you so much. Now I would like to end my assignment part. Thank you so much for listening me out. Allah Hafiz.